Hello, Dr. Lewis here with our Four Dimensions of Health program at Health Revival Partners. Today I'm going to focus in on Dimension 2, which is all about biomarkers, but specifically I'll talk about blood-based biomarkers and how they fit into the four-dimensional program. So really, what we want to think about is Dimension 1 being just fundamental risks. I call it determinants of health, lifestyle risks, things of that nature, your environment, things that can affect our health and well-being. Dimension 2 is looking at physiological markers, really biomarkers, blood markers in particular, what I'm talking about today. Dimension 3 is looking at as Dimension 1 and 2 progress adversely, we might see pathological changes. We can see that in the eye, that's actual tissue changes. That's more progressed than just seeing changes in blood markers or having risks in your life. And then Dimension 4 is you're sick, you have diagnoses, you have pharmaceutical usage, you don't feel well. So let's look at now, so what does it look like? We want you to be proactive. So the closer you get to Dimension 1 and reassess your lifestyle and environment and make improvements, that's really proactive, whereas Dimension 4 would clearly be a reactive. You're sick, now you take action. So we have to recognize that none of us are either healthy or ill. We all live on some continuum between perfect health and death. So whether it's Dimension 1, the extent of your risks determines where you are in this continuum. Dimension 4, do you have comorbidities? In other words, multiple conditions, not just diabetes, for example, but you also have autoimmune disease. That puts you at a different location on this healthy-ill continuum. So let's focus in on Dimension 2, which is physiology or biomarkers. And we've created this whole algorithm and a marker that we call your chronic disease temperature. It's an amalgamation of around 20 different labs that are really great at predicting where you are on the Dimension 2 biomarker or physiology continuum. And in our case, abnormal values reflect actually premature mortality risk. You know, we all have life expectancy based on all four dimensions. But as we get into an adverse situation in any one of these dimensions, our likelihood of dying young or prematurely goes up. And in Dimension 2, physiological markers, we really can create an objective measure of that because it's so well studied. Biomarkers are really what we call the objective rather than just life risks would be called the subjective. So let's take a look at this. So Dimension 2, if you're measuring your labs, particularly before you feel ill or have a diagnosis, that's proactive. And so we want to look at your physiology, but we want to look at things from a very different lens, not just the standard of care where we're looking at acute factors. We want to look at chronic factors in your blood as well. And physiology, when measured and assessed correctly, can really get to the why of why you may be increasing your mortality risk or why lifestyle risk factors are catching up and affecting you. The blood will reveal that. So it's really important to understand the difference between acute versus chronic markers. And in the standard of care, we're really just looking at acute markers for the most part. So when you see your regular doctor. And it's really interesting. Labs Online educated me with the following. There are three important things to know about what are called reference intervals. Now, reference intervals on your labs are really your so-called normal ranges, okay? If your labs come back from LabCorp requests and they're in normal coloration, your reference interval is said to be normal. Whereas if they give you some bold ink or flag it, then you're outside of what's the so-called reference interval. Well, what is that? Well, first of all, it's really a statistically based normal, not really a scientifically based. And this is what Labs Online says. A normal result in one lab may be abnormal in others, so there's no standards. A normal result doesn't promise health because they're really looking at acute, and the difference between acute and chronic is fire versus smoldering. I think we all want to know if there's smoke, not just fire. And then an abnormal result does not mean you're sick. So what's the value of these reference ranges? Well, there's a lot of art in being able to interpret these reference ranges or reference intervals in terms of your future or chronic health. So let's look at what Health Revival Partners does. Our normal values are tied to a mortality factor. What we've done is we've looked at, say, a marker as simple as white blood cell count, where if you have a sustained white blood cell count here as opposed to here, do we start seeing an increase in statistical mortality, early mortality? So any value out of range is tied to an increase in early mortality, and the further from normal translates into higher risk. So if your white blood cell count's at 4,500, your mortality really isn't impacted. You're going to have a good, healthy life based on that marker. But if it's 6,700, there's statistics that show an increase in mortality. 7,800, 10,000. These are all assumptions based on chronic risk, but they're tied directly to published, statistically validated, and peer-reviewed studies. So what's really crucial about this is that if we can reduce mortality risk, it'll mean you live longer. But a lot of people are afraid to live longer because they think they're going to live in disability. But this study here by National Geographic that studied centenarians, 100 people 100 years plus, showed something very interesting. That if you live to 80 plus or minus, you have 19 years of declining health. Think about someone who passed at 80. When they were 60, they probably weren't very healthy. But if you look at someone who's 100 years old today and functioning fairly well, when they were 60, they were probably very robust, had very few adverse circumstances, were sleeping well, didn't have chronic pain, things of that nature. So you really only see 9 years of declining health if you live to 100 plus versus 19 years of declining health. And all these, what declining health means in this context is really chronic conditions. So it's in your best interest to reduce your risk for mortality. And in my context here at Health Revival Partners is to lower your chronic disease temperature, your blood labs. And I'll go into what those blood labs are in a moment. So here's a report, part of a report that we generate for our patients and participants based on this chronic disease temperature algorithm. Now we run a biomarker panel of 55 markers. 20 really tell us a lot about your chronic health risk. So we give you an overall score, a single number tied to 20 markers. So this person had a 102.9. I'll get into what that means in a moment. But it's tied to 98.6. They're elevated. So they basically have, rather than an acute fever when I take your temperature, sort of an internal chronic fever. And we want to get that chronic disease temperature down as low to 98.6 as possible. So we can see some of the markers here that are driving it. Glucose, high A1C, insulin, slightly elevated white blood cell count, sedimentation rate, fibrinogen. All these markers are contributing to this overall global temperature, chronic temperature for this individual of 102.9. And we can see, based on a 0 to 10 scale of risk, that most of their risk resides in diabetes and stroke, whereas they appear to have very low cancer or very low heart disease, let's call it a heart attack risk. So here's what we give in our report, Understanding Your Labs. So individual lab values are important in understanding both your acute and chronic health risks. But more importantly is the story of the labs when we take a look at them together. And we'll be doing some videos on how we interpret not just an individual lab, but how the labs work together in telling your story. So optimal values, we've established a science-based optimal biomarker range or ranges by determining through researching the worldwide medical literature when the level of a marker is associated with an increase in early mortality risk based on sound statistical analysis. We're looking at multiple studies, basically doing a meta-analysis in medical biostatistics jargon. So your chronic disease temperature, this is a single value displayed at the top of your report. It's the combination of multiple markers, each of which may or may not have an indication of excess mortality, but we basically average each marker into a final number. So taking a look at multiple markers is always going to be more accurate in terms of characterizing what's going on in your body compared to looking at a single marker. So if we look at this, we're using the temperature scale. So 98.6 means from a chronic perspective, you have perfect blood. And anything above that infers that you have a chronic fever. This is not your core temperature. It's looking at inflammation and other dysbioses in terms of what your blood's telling us about your health. So in this case, this person had a chronic disease temperature value of 102.9. Now, if you had a 102.9 from a thermometer, you're running a significant fever. If you met this person, you'd realize that they have a clear chronic fever, if you will. They're chronically ill and at risk of early mortality and are suffering from disability from a number of different conditions: autoimmune disease, cardiovascular disease, diabetes. So here's an example of just the top of a report from a before and after. So we ran this person through our testing and through coaching and through medical consultation, and their chronic disease temperature before was a 104.7, very serious health issue with this individual, or issues in the chronic sense. And we brought that person down over a 6-month period to 102.7 and still working to lower that as close to 98.6 as we possibly can. But you can see we're heading in the right direction. Whereas if you're looking at individual labs, it may be confusing. Am I improving? Okay, I might feel a little bit better, but overall, is my physiology improving? Well, the chronic disease temperature with the single score allows you to very accurately assess if your doctor's doing the right thing and to see if whatever changes you're making are heading you in the right direction, are working for you. So you can order this biomarker panel we call the chronic disease temperature on our website. It's a 55 marker panel, and when you order it on our website, it always comes with a 1-hour consult to discuss the report from the reference interval perspective from LabCorp Quest, wherever we ordered it from, but also from our lens, looking at it much under a microscope, looking for the smoldering, the smoking, not just the fire. So here's how you come to our site and order this panel. You go to healthrevivalpartners.com and click on the menu item services, but this is the URL /shop, and it gets you in a position to order the lab panel and the consult that go together. So this is dimension 2 of the 4 dimensions of health program. We have determinants of health, we have physiology, which we measure with our chronic disease temperature, pathology, we actually measure it with eye exams, and then are you sick? We look at what medications you're on and what diagnosis you have. That sort of characterizes you in the 4 dimensions of health. I hope you found this presentation helpful, and I look forward to you ordering your blood labs and having a 1-hour conversation and telling the story of what's going on in your body physiologically. Thank you very much.